Good evening, ladies and gentlemen. Welcome to the second edition of CxO's Health Tech Show labeled Health is Wealth. I'm your host, Bilal Mumtaz, co-founder of Ailaaj. As you very well know, over the past year, 300 million US dollars have been deployed in funding for startups in Pakistan. This proves to be one of the largest ever injections of capital in the whole MENAP region in its entirety, ranking us at number four amongst other countries in the region. I have today with me a very special guest who I've known for quite a while, Mr. Ammar Jaffri, who serves as the Director General for the Center of Information Technology based in Islamabad. How are you today, sir? कैसे हैं आप?
I'm,
Assalamu
I'm
alaikum.
just fine. I'm just fine. Please. Thank you much. Thank you.
So, we are now going to talk about health tech in Pakistan with a guest who has been involved at the governmental level, namely in the field of IT. When it comes to discussing healthcare matters, because it's such a nascent field in Pakistan, it's rather difficult and perhaps not as pertinent to involve someone directly from health tech because there's not that many players. You either involve people who are working for healthcare institutions or who are working in the field of IT. And we have a stalwart in the field of IT with us. So, Mr. Ammar, I'd like to start off by asking you what your background is and how you came to be bitten by the health tech bug in Pakistan.
Okay, fine. Thank you very much. Firstly, thank you very much for inviting me. My name is Ammar Jaffri. I am former additional Director General FIA. I served 40 years in the federal government. And after my retirement, as my post retirement agenda, I decided to do whatever I knew. So I had the proud honor of building the IT infrastructure in Pakistan in a number of projects. The first one was the immigration system, which is what you call border management system. I designed and implemented it from the very scratch. Second is the cyber crime wing of FIA, what you call today as NR3C, National Response Center for Cyber Crimes. Alhamdulillah, I have the honor of building it from the very scratch. And thirdly, I was part of NADRA for a quite number of time. And after that, I remained a team role in the machine readable passports and fingerprinting systems of Pakistan. So, with all that background, when I got retired, I thought to do whatever I knew about it. So, that's why I came to this field, which I called Digital Pakistan Vision 2025. So, I started very humbly from a village because I had two options, one to top down and one to bottom up. So I decided to go for the bottom up because I was not trained for this type of work which I'm doing right now. So I think it's more than 10 years now. I started from a pilot e-village and I started training people in villages in ICT initially. So passing through different phases of development. Today I am focusing on SDGs, which is Sustainable Development Goals. I am focusing on emerging technologies. And when I say emerging technologies, it means artificial intelligence, Internet of Things, blockchain, Industrial Revolution 4.0, cybersecurity, cloud computing. So I'm just trying to make a sincere effort under a partnership model that we should take the power of technology at the grassroots. So I will start with saying something about SDGs generally. Then I'll specifically touch upon SDG 3, which is health and well-being. And in that domain, I will talk about the telemedicine or healthcare, what you're talking about. So SDG is a global agenda. It started with MDGs, and then now we call it SDGs because after 15 years of progress in MDGs from 2000 to 2015, we switched over to SDGs, Sustainable Development Goals. In these SDGs, I think the first six SDGs addresses the basic needs of a human being. One and two are for poverty and hunger. Three is for health. Four is for education. Fifth is for gender balance. and six is clean drinking water. So these are the basic human needs. So after that, we have SDG 7, which is renewable energy. 8 is something like decent work. 9 is again entrepreneurship innovation, what we are talking about these days. And then in 10, we talk about balanced work. Then in 11, we talk about smart sustainable cities. In 12, we talk about responsible consumption. 13 is very important, in which we talk about climate change, which is the global agenda now. And in 14 and 15, we talk about life below water and life on land. Then in 16, we talk about transparency, and we talk about interfaith harmony, and then we talk about good governance, all these things. And in 17, we talk about the local and regional partnerships. So these 17 SDGs have been designed on a rule that everything works in a framework, everything works in a policy, everything works in an ecosystem. So now I will talk about SDG 3, which is health and well-being. In this, there are a number of targets, and how the SDGs work is that the authors of SDGs have actually spelled out certain targets, and to achieve those targets, you have to make some measurables, and those measurables tell us the timeline and actions which we took. It's very systematic. You can't go beyond those targets. You can't go beyond that action items. So when we talk about SG3, it has number of targets, and every target addresses a specific need of the human being. It talks about infrastructure. It talks about the capacity building. It talks about the human resource development. It talks about the taking the service of the government in health and healthcare at the grassroots. So all these things are covered here.
That's very fascinating. Yeah. It's
Yes.
just also, I don't know if you'd be able to answer this question, but I found it fascinating when you mentioned that you were part of NADRA as well. And as you know, in the wake of the COVID pandemic, the NCOC, I believe, was also formed that takes into account data of whether people have been vaccinated or not. So, do you know if NADRA is currently linking up with NCOC to get that data? Because I know a lot of startups that are linking up with NCOC to find out, data of whether certain people have been vaccinated or not.
So, firstly, about my relation with NADRA, let me put on record that I was the first grade 17 officer of NADRA. First grade 17 of NADRA at a very, I was in my early 20s at that time. It was not named as NADRA at that time. It was National Registration Authority. Subsequently, it was named as NADRA. So that's my relationship with NADRA. And now coming back to your question, actually, NADRA is providing information to a number of departments, including the NCOC. And I think NCOC is doing a wonderful job, and we must appreciate the entire globe is appreciating Pakistan of how they handled the COVID situation. Actually, they handled it very smartly. All those countries which put it a very strong embargo on few things, I think they had the problem later on, because the issue with developed countries is totally different. The issue with developing countries is totally different, and the issue with underdeveloped countries is totally different. Actually, our workforce is dependent on physical activities. So if we have some sort of very stringent lockdowns, then we have serious problem for that. So I think this data with the NCOC is going to help a lot, because apart from the information they're getting about vaccination, there are a lot of other information also about the healthcare, and I'm sure the NADRA in coordination with NCOC is going to do wonderful work. Thank you.
That's a very comprehensive answer. Thank you very much for that. And I think you've done terrifically in explaining all the 17 Sustainable Development Goals. And yes, because this is a show on health, the third one, which actually is good health and well being, will probably be emphasized on the most. And my question to you is, how can technology help leverage achieving the targets of this specific sustainable development goal, specifically in the field of telemedicine, which you have spoken on before and which carries on as an interest of yours at heart.
Thank you. First, I would like to respond to telemedicine, and then I will talk about the general role of latest technology in SDGs. What is telemedicine? You have a traditional way of going to the hospital is very simple. You go to a doctor. Doctor gauges your some medical vitals, and based on the medical vitals and the lab reports, definitely he gives the prescription, and you get the medicine, and then again you go on back. So this arrangement was working for so many years. I think for the first time, and the COVID actually disrupted it very nicely. And this was a positive disruption. Before that, there were a lot of efforts on telemedicine. What is, as the word says, that you are giving the medical advice or medical prescription to a person when he or she is not available to you physically. So I think in advanced countries, even you are going for the telesurgeries, you can carry out operation on a person based on some gadgetries in which you operate the person. But it is the problem in the developing countries that they have the typical style in which they physically want the body touched by the doctor. Unless वो नब्ज नहीं देखेगा आपकी तो वो काम नहीं बनता आपका ठीक है This is a very strange, right? So when we started telemedicine initiatives in Pakistan, especially, the initial resistance was from the doctors itself, because doctors never wanted. Because at time doctors take a pride in it that actually there are so many patients sitting outside the clinic. So if you go to advanced countries, you hardly find three, four patients waiting on the line. But in developing countries, there are so many patients especially in the government hospitals.
Yeah, it
So
rings a bell, yeah, because there's only, 200,000 doctors to service the
exactly,
entire nation, more or less. And
exactly,
that's just the people who claim they're doctors.
exactly,
Less than half of that are actually PMC verified. So
exactly, exactly.
those are the stats we're dealing with.
So the problem is that we have very difficult topology in Pakistan. Number of people are living on mountains. Large number of people are living in unserved areas. There is no doctor. So what was the logical result? The logical result was that the power to give medical healthcare services went to the quacks, went to the paramedics, and they actually looted the people. But there's a need for linking the authorized doctors, the doctors who have been the formal education and all these things. Plus, healthcare today is an ecosystem now. You cannot depend only on the medical specialist. The medical specialist has to take help from the laboratory, and then from the laboratory record at time you have to go to some high level of the specialist doctor. So this is a complete framework in which the medical system operates. I
Not to
think in
mention
the
pharmacy as well, which
yeah,
actually I've
pharmacy.
been affiliated with
Definitely,
for many.
definitely. Pharmacy is something very important element. So this ecosystem works very nicely if you are working in a telemedicine environment. But it has a lot of built-in inaccuracies when we go to the grassroots. When you go to the grassroots for giving the telemedicine services, then you need three things. One is that you need a doctor. Second is you need a paramedics or somebody who is in the remote location and can facilitate the medical vitals knowledge to the doctor. And third is that you need a platform. Either it can be an app or it can be a PC-based system and blah blah blah. I think there are some organizations working in Pakistan. They are working very nicely. Alhamdulillah, I am part of a committee which is headed by the President of Pakistan, and they are working very nicely on this initiative. I think there is no dearth of this telemedicine systems in Pakistan, and some companies are some Pakistani companies are really doing an amazing job. Even some Pakistani living abroad are doing some very amazing job. The problem is that there's a great disconnect between the people living grassroots and to the doctor, because doctors are in a large number of cases are in the big cities. Now, There's an connection problem. Second is there's a electricity problem. And third is the distrust of the patients on this medical gadgetry. They don't believe in it. They want doctor to be physically there. So with all these mindsets, with all these complications, we are operating. And I think that we need to understand it, that this is the dilemma of majority of the underdeveloped countries or even the developing countries. So there's an urgent need because now I think our medical system infrastructure cannot afford it now. There's urgent need to number one create awareness. Number two, make some robust system which can work even on a very low bandwidth because in number of locations in Pakistan we have very low bandwidth. So that the issue we have to address. And I think third is that we should have the doctors mentally prepared to give cheap services because the people at the grassroots cannot afford these high prices. So with all this, we can make the telemedicine possible. And I would suggest that instead of linking the doctor with the patient immediately in the first phase, I think let's start with some sort of services in which the direct connection is not required. For example, we can start from the skin trouble, we can start from the X-rays, this radiology field, in which the patient goes to the hospital, have his or her X-ray, then this X-ray goes to some doctor in an offline environment. The doctor give the comments and it comes back, and the doctor physically there takes the decision. So if we can start with this, I would call it a offline medical support system, I think online we're definitely going to work very fast.
Yes, it makes a lot of sense. And even when you talk about how there's a lot of the population living in very remote areas, it was no surprise that the first ever governmental initiative for telemedicine actually, I think, started from Mansera and KPK. I think it was a telemedicine initiative called Ailaaj, where they actually, sat down consultants that could actually consult patients from a governmental level. And, we now go further into delving into the different types of technologies involved in bringing healthcare, to an optimal state in a country that is, suffering from, a large part of it being very rural and underdeveloped. It's suffering from the fact that a lot of people aren't able to keep up with inflation. There's still a lot of poverty. There's not, you forget about healthcare systems, even in your most high performing government institutions, there's not that much technical integration. So even, say, startups that want to work with such institutions have to face that gap. So, as mentioned, let's talk about six main tenets of IT and how they can be used to better healthcare in Pakistan. So let's talk about how IoT can be used, how artificial intelligence comes into play, how IR 4.0 comes in the picture, how we can use blockchain, how cybersecurity will become an even more pressing concern, and how cloud computing will essentially pave the way for the future. I think you touched upon IoT, maybe in the first phase, right? Alongside AI being used for such fields as dermatology or radiology, IoT can certainly be used where even if a patient is interfacing with a doctor through a screen, there is some assistant that can take vitals or other metrics through devices that can then upload that data straight to the cloud. I think that's great. So let's talk about these, variants of tech and how they can pave the way for healthcare in Pakistan.
Thank you, Bilal. Bilal is a word saying that if you're not part of the solution, you are part of the problem. Right? So I started being, I told you about my humble contribution in government. So when I came to the private sector, I started contributing whatever I knew. So I started an initiative called Health Sehat Plus. I named it Sehat Plus because Sehat is the word commonly known. Plus means that I am adding value to it. So this is my private limited company, and I'm working on it right now. So what I did, I started from a WhatsApp group. The problem is at a grassroots, and Sehat Plus is not aiming the big cities. It is giving the grassroots. So I'm thankful to the doctors who agreed to charge very less amount, because if you try to engage doctor free, I think it's not going to work, because everything has a price tag. So, but my humble request to those doctors were that they shouldn't charge more, so we can afford it. So now we have built up a system which starts from a WhatsApp. Even on the WhatsApp, we have made some a framework in where the doctor talks to the patient. Then doctor gives some. Actually, in this group, we have certain laboratories and certain things. Then doctor send the test to the laboratory. Then laboratory upload those, and everything works fine. But I think this is not a reliable system. Then we are actually depending on apps. We are have a website. The biggest challenge in this is healthcare system is that if you use latest technologies like IoT, for example, you can easily use smart things to gauge the medical vitals. It can automatically work. Now the gadgets have come that if you just touch the device with the body, it gives you everything, including the blood sugar. Without penetrating into the body, you can get the blood sugar. How? Because something is installed permanently in the body, and that something remains in contact with the blood. And the moment you have some IoT device with the body, it tells you the blood sugar, right? So then if you have access to the human blood, then you can have number of tests on that. And now the devices have come which transmit this information directly to the doctor at the remote locations. So, for example, now there are a number of sensors which have come that if you put those sensors in the washroom, so when you have your toileting, then the automatic report about your sugar in the urine, or anything which is to be gauged from the urine, or some stool, the information goes to the doctor directly without any. Now it's a challenge that the doctor must know that this person is using it. So there's a biometrics into that, so that the wrong information doesn't go there. So now these devices have come. There's no need to go for the paramedics to go to the person. Now here comes the role of artificial intelligence. Now through artificial intelligence, now the machines are learning what to do in this situation. So all these latest technologies are available in paramedics, and especially if you go for some, let's say, if you go for this breast cancer. In this case of breast cancer, you have some early warning systems. So if you have some preliminary test on the body, then these you can save the person through these early warning systems. Then in the radiology field, definitely if you have got CT scan or you have some chest X-rays, now there are a number of gadgets available which identifies the patterns. That if this pattern is going, then it is going to that. So through machine learning now, even the pharma companies are using the information that if we give this person X medicine with Y medicine, then how it affects on the body. So all this information is called data analytics. Data analytics is the emerging science in which, by applying different algorithms to the data, you can take certain decisions. To my understanding, I think very shortly we will have robots which will make decisions based on the. Naturally, robots are not going to take decision about the sensitive sort of medical issues, but I think the 70-80% of the medical vitals will be gauged, and definitely the patient will get the prescription, and that will be very close to whatever we are doing now. So I
That's
think
that's actually called precision medicine, that whole field.
precision medicine. So I think the big gap in the rural areas, I think, in Pakistan. But again, it's a matter of that any sophistication we go, it is now the trade-off is the increase in prices. No, the government can come forward, the donors can come forward, and that's how we can reduce burden on the poor people. So it's a big challenge. We have to move forward, and we have to move forward based on our resources. And I'm very sure that now the cheap technology is very fast coming, but again, the challenge will remain the access of internet to the unserved areas. Every device doesn't work on low level bandwidth. You have to achieve the high level bandwidth. So I'm very positive that I think in 2 to 3 years to come, the medical healthcare system will improve a lot using all these latest technologies in the telemedicine healthcare system.
That's quite comprehensive and really that's like laying out the entire framework for how health tech can actually unravel in the years to come. So, as we're nearing the end of our show, I'd like to just ask you one final question. What's your message for all Pakistanis out there, and what part can they play in
Okay.
making us a healthier nation?
I will especially request the overseas Pakistanis listening to me that this is the time. I think these are the defining moments for Pakistan. Don't go, don't have wrong impression from the media, because media is telling what is selling now. So I think there's a great hype of technology in Pakistan. I am very excited about it. I think daily I spend 15 to 16 hours on talking on all these things. I have 3, 4 webinars, and I am practically involved into it. I have started a project which is called University Plus, which aims to empower the future leaders of today. Because the future leaders of Pakistan right now in schools, in colleges, and universities. So anyone from abroad can help me. You can Google me, Ammar Jaffri. You can reach me very easily. If you genuinely want to help Pakistan, please help to build the capacity of students in the university. And I made a very easy to use formula. You volunteer your 4 hours, 6 hours, 8 hours for Pakistan. I will engage you with the university students. You guide them, help them, because universities are teaching what the teachers knows there. We have to teach them the demand driven knowledge, which is right now in the advanced countries. So the project University Plus aims to empower the students to solve the community problems whenever they get their degree. Thank you very much.
Thank you so much for being on the show, Mahajafri. Karta hun ka bahut shukriya. Allah Hafiz.